Tonight, on St. Elsewhere.
No, I'm gonna kill you, you bastard! I'm gonna kill you!
The only way we're gonna know for sure is to open them up and explore, so let's get on with it.
If we don't find anything?
We sew them back up and that's it.
I didn't want to come here. And frankly, I have nothing in common with you people. What is it in my personality that bugs people?
You're really a closed, narrow-minded, judgmental human being.
Wait a minute, what's going on around here? We'll get an arrest.
Open up the chest.
Something went wrong because ever since you did your first solo, you've been dying to cut again.
Right there, fellas. Come here. Sit down over here. I think this is going to make you feel better. Don't you just love these quiet, carefree nights?
My metabolism thrives on chaos. Inactivity breeds discontent.
Just try to relax. I'm going to give you some Demerol, and we're going to try this again in 20 minutes. Did you hear about Peter White?
Yeah, he's in bad shape.
Westfall read him the riot act. Told him to stay home for a couple of days. And said he had to start a drug rehab program.
That's depressing. Can't we talk about something else?
Sure.
How about your sex life?
Was Mr. Tepper's neck mass biopsy?
Well, the patient has had 4 or 5 fibromas removed over the past 6 months.
See that. Does he have any history of neurological disorders?
Other than some diffuse bone pain, he's complained of weakness in the lower extremities.
All right. Have you ordered a skeletal survey?
No.
Well, I think a skeletal survey is in order, and probably a bone scan, too. What do you think?
Yes, sir.
Dr. Chandler, how's Mrs. Grant?
Excellent. Vital signs are stable. She's able to hold down her food.
Still craving pizza?
No, now it's Chinese food. Mugu Gai Pan.
All right. Dr. Wade, what was the etiology on Mr. Evans' flank pain?
He has a kidney stone. It's been sent for analysis. I'm just concerned about why his amylase level is so high.
Excuse me, Dr. Wesley.
Hi.
Dr. Banzik just called. He can't make your meeting.
Oh, damn. Is he at home, do you know?
No, Beth's on.
Is he working?
No, his wife just had a baby.
Bad timing?
The worst.
Mr. Rizzo, hi.
Ah, back so soon?
How you feeling?
Yeah, so-so.
How much?
It's 98.7. It's down from 103 an hour ago.
Huh. Thank you, Juan.
Yeah, thanks a lot. So, what's the story? Am I dead or alive?
I saw your lab results from this morning. Your cortisol is within normal limits. Thyroid function studies pending.
But?
Well, we don't know what's causing the fluctuations in your temperature, or the loss of weight, or the constant hunger.
Think it could be something with the pancreas?
Might be. Your fasting blood sugar's in the lab. Anybody in your family have diabetes?
No. So you think something could be throwing my sugar out of whack, huh?
It's possible.
Something like some kind of growth or tumor or something?
I really can't say at this point, Mr. Rizzo.
Vietnam, 1968. Me and my buddy are in the thick of it. Noise in the bushes. Think it could be Charlie, I says. Could be, he says. That was the last thing he ever said.
I'm not trying to be evasive.
Okay. So just tell me, are you gonna go in and probe and poke and see what's cooking or what?
Some exploratory surgery may be necessary.
Well, I can't say that I like it, but that's what you gotta do, then do it. Nothing was ever solved by running away from things, huh?
Mr. Rizzo, if I only had a few more patients like you.
Go on.
We missed you at doubles yesterday.
I was having my weekly rendezvous with Dr. Chegley. He reminds me of Mrs. Galando, my fourth grade school teacher. Strict disciplinarian. He's determined to smack my misbehaving immune system back into line.
How you feeling?
Excellent. Just going over the results of my tests, I would say my numbers are extremely bullish.
That's terrific.
You were absolutely correct, Donald, about the chemo. My cancer's down. Hopefully out. Is there something I can do for you?
Yes, as a matter of fact, there is. I've been asked to give a sermon to the incoming med students in the 6-year program over at BU.
So how can I be of service?
Well, I asked Dr. Benzik over at Beth Zion if he could help me out today. I was thinking of mixing medicine and surgery, you know what I mean? But his wife decided to have a baby.
Oh, I suppose that calls for congratulations.
I suppose.
Leaves you a man short.
Right. Are you free?
I had promised Catherine to have lunch with her at Lockover's to celebrate my new lease in life. But we can always manage that some other time.
No. That's important. I wouldn't ask you that.
Have you thought of asking Mark?
Mm-hmm.
It was incredible, Jack. I'm talking about a small bowel resection, okay? And I pulled that baby off in under 2 hours. Even Craig was bowled over.
That's great.
Yeah, I really caught that one. 2 things to worry about in life, huh? Your work and your wife. 1 down, 1 to go. Okay, now who is this guy?
Anthony Rizzo. He's a meat packer. What do you see?
Nothing. As far as this abdominal series goes, he's clean as a whistle. There's no air fluid levels. There's no obstructions.
What do you think we should do?
Hey, I'm into stainless steel. You know what I'm going to suggest?
You think we should open him up?
Depends on who you ask. If you ask me, I say yes.
Why?
Because we don't know what's wrong with him. The only way to find out is to go in and look around.
Yeah, but it's not as if Rizzo's going to drop on us in the next hour or so. His vitals are fine. All his labs are within normal limits. Besides, if you do operate, it won't be the first time. You should see the scars on this guy.
Well, do you mind if I take a look at him?
Sure.
Okay.
Go ahead.
I can tell you right now, we're going to have to cut.
Oh, you think I'm gonna give you $2 for that? Oh, I think that you better. Whoa, no. What are you gonna do if I don't? I'm gonna tell the God. And then you're gonna sing. You're gonna...
This is amazing.
Just another day in the naked city.
Maybe there'd be less trouble if we were all naked. I mean, we wouldn't have to worry about concealed weapons.
Something I can do for you, Kathy?
No, thank you. How's Wayne?
Oh, Wayne, he's fine.
I heard the two of you are seeing each other.
Well, we're not really seeing each other. We've gone out a few times.
I don't feel bad.
Good.
I feel a certain glow. Like now there's a connection between you and me.
Oh, excuse me.
Get away from me! Get away from me! Get away!
What's the problem here?
He wants to sit down.
Well, is there a reason he can't sit here, ma'am? No one else is using it.
I'm sorry. I was just saving the seat for my friend. But I'll leave if you want me to.
No, it's all right. It's all right. Sir, why don't you sit over here?
Oh, no. What are you going to do?
You're such a sensitive fellow.
Wayne?
No, Warren Applegate.
Oh.
Some people think we're a mismatch, but actually we're very compatible.
Warren Applegate in dermatology?
We're the correct imbalance. He is what I am not, and vice versa.
That's for sure.
Warren's very soothing and stabilizing, like Mr. Rogers.
Sounds stabilizing.
Surely we should double date.
Double date? You mean the four of us?
All that interaction and social intercourse, just think of the possibilities.
Yeah, well, we'll have to do it sometime.
How about tonight?
Tonight?
None of us are on call, I've checked.
Well, okay. But I have to ask Wayne, you know, in case he's made other plans.
Let's talk it over at lunch.
Okay.
That's a talented kid. I just don't think that Terry is suited for a career in surgery. I'd like to push him into medicine.
Why is he so hell-bent on surgery?
Well, it's in the family. His old man is a surgeon, you know. Keeping up with family expectations. Would you talk to Terry?
Maybe I should talk to the old man.
Even better.
Oliver, how are you? Mark, can I talk to you?
I hear Benzig's wife threw a wrench in your plans today.
Yep, she really did. That's why I was looking for you. I was hoping you could help me out.
Why didn't you ask me in the first place? You've had this talk scheduled for weeks.
All right, Mark, I just didn't think it was your cup of tea.
It's not. This affirmative action crap doesn't hold any water
It
with
is
me.
not affirmative action.
I know. It cuts the cost of a medical education.
It does.
But if they're not careful, it'll cut the quality, too.
All right, here's what I think. I think it's very important for these kids to spend some time in the hospitals and in the areas where they come from. Do you understand what I'm saying? That's what I'm trying to get across. Now, a man of your stature could help me.
Crying out loud. Victor Benzik has the lisp of an atom. I mean, he can hardly talk to a patient, much less a group of people. What possessed you to ask him?
I wasn't thinking, pal. I'm
You're
sorry.
damn right you weren't.
All right, are you going to step in and pinch hit?
Look, Donald, I'd like to help you out, but the fact of the matter is that there's no chemistry between me and those low-income kids.
They're very bright.
It doesn't have to do with intelligence. It has to do with taste and culture.
All right. Now, I'm in a bind. And you'd be bailing me out, and it would be a huge personal favor.
Well, if you put it that way, how can I refuse?
All right. Thank you. 12:30 and I'll drive.
Yeah.
Well, it all started on the weekends. And before I knew it, it was every day, and I was dropping thousands of dollars a month.
You know, the funny thing is, I didn't think I was doing anything wrong. And that was even before I started freebasing. Cocaine became my best friend. My career went out the window along with my wife and my home. And that's when I decided to come here.
How long have you been clean?
20 days, Paul. I graduate tomorrow.
Oh, that's wonderful, Stuart. Grab a seat. Stuart's lucky. Actually, it's not that easy to quit. You've got to constantly be on guard for those moments when you feel the most susceptible. When you feel the need to take your own special drug. Nan, this is your first time with us. What are you addicted to?
Codeine.
Now, just before you felt the need to take the codeine, what were you usually doing?
Well, I was at home.
Go on.
Last winter, I had a cold. I can't take pills, so my doctor prescribed codeine cough medicine. I didn't realize until way after the cold was over that I was still taking the stuff.
Why do you think you needed the codeine?
After my husband went off to work and the kids left for school, I'd find myself wandering from room to room in that big house of ours. I didn't know what to do with myself. I was all alone.
It's all right, Nan. We've all cried in this room. Go ahead, let it out. Yes, Peter. This is Peter's second day.
All right, I got a problem. Well, this is crazy. I gotta go.
According to the abdominal ultrasound, Mr. Rizzo, your pancreas is fine, but you've got hypoglycemia. So we're starting 72-hour fasting glucose and insulin levels. This is Dr. Ehrlich. He's a surgical resident. No, I've only asked him for a consult.
Don't tell me.
Don't worry. They won't let us operate anymore unless the patient is unconscious.
You two guys like a regular tag team, huh? Gorgeous George and Bobo Brazil.
Are you a wrestling fan?
Fan? Come on, I practically live there. My cousin Ralphie's an announcer down at the Garden.
Yeah, you ever meet Bruno Sammartino?
Are you kidding? Me and Bruno? Do we go see the Aqua?
Well, anyway, I'm going to want to have a look at you here.
Yeah, sure. That's what all the surgeons say, huh?
Oh, boy. You weren't kidding. You've been through it all right. They took your appendix out?
Yeah, August 11, 1978. Woke up with cramps, you know. Thought it was from this fish joint I'd gone to down on the pier. Fresh catch of the day, right? Yeah. Should have stayed with the scampi.
What about this one?
Oh, that one. Super Bowl Sunday, 1976. I lost $50 on the Cowboys. Damn that Bradshaw, huh? I had a stinging pain right after the game. They went in and had to take down some adhesions.
Okay, I'm going to want to feel your abdomen now. Take a deep breath. Let it out. Just relax.
Feeling for masses, huh?
That's pretty good. Where'd you learn your medicine?
You pick it up, unfortunately.
You know, I don't feel anything abnormal here.
Amazing. Your temperature's back up to 102. An hour ago was normal.
So what are you gonna do?
We're still in the talking stage.
You want to go inside, don't you?
We may have to do some exploratory surgery to find out what's going on, if your angiogram is normal.
What do you think?
Certainly one possibility.
Story of my life. Well, if that's what it's got to be, then that's what it's got to be. Let's get it over and done with so I can get out of here. What do you say?
Nothing's definite yet, Mr. Rizzo.
It's like frickin' frack. You guys a couple of regular politicians, right?
I need another urine sample.
No problem. Well, see you later.
Okay. So,
Nice guy, huh?
yeah. How about his abdomen?
Well, it's hard to tell. If there's a tumor, it may not be palpable, especially if it's endocrine in origin. We should open him up and look around.
I don't know. It just doesn't fit together somehow. His tests are negative except for fluctuations in temperature and low sugar. I want to think about it and wait for serum insulin levels.
Spoken like a real internist.
Mr. Rizzo? Yeah, in 405. He's going to be giving me another urine sample.
Okay, I'll send someone down.
Oh,
What?
would you get me a temperature on him every hour?
Yeah, I'd be delighted to. Okay.
Okay, thank you.
Is he allergic to penicillin?
No.
Any other drugs?
No, not that I know of.
Hey, give me that. Has he had any recent illnesses?
No.
Has he had any complaints lately? Fatigue?
No.
Has he been eating normally?
Well, no.
Put that down.
Come on, Wayne, what's the big deal? Look, we'll go out with him, we'll get some food, we'll see a movie maybe. That'll be it.
Look, I can think of plenty of things I'd rather do than doubling with Kathy Martin and Warren Applegate, like getting my teeth drilled.
Oh, he's not a bad guy.
That's right. He's a nerd. He's the kind of guy that has one of those plastic things in his shirt pocket with pens and pencils in it. Hello, Wayne. What a lovely, lovely day, Wayne. Used to be she just worked with stiffs.
I was able to put her off for now, but she wants us to meet them for lunch in the cafeteria.
You really don't like me, do you, Shane?
Come on, you'll see. We'll have a good time.
I used to sleep with her all over the hospital.
I don't care about that. I have a history, too. Wayne, this is an overture of friendship.
Okay, I can handle it if you can.
Don't worry, I can handle it. Oh, no.
What?
That woman over there, she's been waiting all morning.
Oh, terrific. You know, my mother always wanted me to be a TV weatherman, and I just laughed at her. Sorry, man, but this woman is sick before you. Hi, I'm Dr. Fiskus. What seems to be the problem?
My stomach hurts.
Well, that's no good. But you're in luck. This week we're running a special on abdominal distress. That includes parts, labor, a free checkup of all vital systems, a 5-year, 50,000-mile warranty, whichever comes first. So, if you will just step in here, we'll see what your problem is. How long has your stomach been hurting you?
I don't know.
Well, that's pretty general, isn't it? I mean, a day, 2 days, a week, a month? Since Yom Kippur, what?
I don't know. A while.
Okay, a while. Any diarrhea, vomiting, constipation? Any nausea? Have you had a fever, missed a period, anything like that?
It hurts all over here.
Okay, well, is it a dull pain or a sharp pain? Is it there all the time?
It just hurts.
All right, are you on any medication? Have you taken any drugs?
I don't take drugs.
Well, good for you. Okay, then, why don't we just take a peek? I'll have my lovely assistant draw the curtain, and you wouldn't mind lying back on the table, would you, and unbuttoning your blouse a little bit? Shirley?
Don't you touch me!
I'm just going to help you, that's
Don't
all.
you lay a hand on me!
Oh, come on now. Come on, just relax. Everything's gonna be all right.
Just tell me to leave me alone!
Okay, call up the psych and tell him we got someone for him. We'll put her in restraint so she doesn't hurt herself. Hey, this is Abernathy. Why don't you come back here now? Everything's gonna be all right. Come on. Everything's all right.
What I'm trying to say is probably explaining the obvious to you. There is, in fact, an urgent need in inner city hospitals like St. Eligius, communities like Roxbury, Southie, for affordable, skilled medical care. And we hope that when you finish this program and your training, that you will seriously consider careers in the areas where you're needed the most.
Dr. Westfall?
Excuse me, before we open this up for questions, I would like very much for you to hear from our chief of surgery at St. Eligius, Dr. Mark Craig. Mark?
Thank you. We're running a little late here, but I want to toss in my 2 cents and echo Dr. Westfall's fine words. My son is graduating from Ohio State in June, so I think I can relate to you all. Your communities need you, and to serve them in a medical capacity is a privilege like no other. Thank you very much.
Excuse me, doctor.
Yes.
How much money do you make a year?
More than the mayor, but less than Dr. J.
Do we have the same opportunity to make that kind of money in a Roxbury clinic?
No, you don't.
I didn't think so.
Is your son gonna be, quote, privileged to work in a community like this?
Okay, let's take off the gloves, Let me tell you, I didn't want to come here because I figured it would be an exercise in futility. And frankly, I have nothing in common with you people. My ancestors came off the Mayflower. My grandfather was a distinguished surgeon, as was my father and myself. Now, why would you, for 1 second, think that my son would set up practice in Roxbury or Charleston? Now, come off of it. He's not connected with those places, but you are. Now, personally, I don't blame you if you take the money and run. But if you do, nothing is going to change. Not for the better. You are the future of your communities, not me. So put that in your pipe and smoke it before you start tossing out a lot of wise-ass questions to me. That's all.
Dr. Craig, if you feel that way, why do you stay at St. Eligius?
Because I couldn't find a better job.
Okay, Anthony, now that didn't hurt a bit, did it?
You're right. I heard a lot.
Anyway, that's what they used to tell us to say in nursing school.
Well, you did this all pretty good.
Yeah, I did, thanks. And I don't usually do this, but seems like most of our lab technicians came down with an acute case of spring fever.
So, how long you been a nurse?
Oh, all my life.
My ex-wife always wanted to be a nurse.
Yeah?
Hated school, though. She's a hostess now, one of those restaurants in the Mass Turnpike.
Which exit?
14.
Huh.
So, do you like it? I mean, nursing?
The hours are long and the food stinks, but I love being a nurse.
Huh.
Okay, open up. I want to get another temperature on you. Back in a minute.
I never sent anybody in for my urine sample.
Oh, it's okay. I'll take it.
So what'd you guys think about that power failure, huh?
caught me in the middle of a shower.
Down, big boy. So what happened?
So anyway, Alice and I are sitting on the couch last night, and things are getting hot and heavy. And she says, I know I slept with all those other guys right away, but you're different, Victor. You're special.
You believe that? Right. What'd you do?
So I said, no, you got it all wrong, babe. I'm not different. I'm the same as all the rest of them.
Come on.
You don't really like me, do you?
We're just having lunch with him.
Well, as long as he doesn't touch me, you know what it's like with dermatologists. Cootie.
Yeah. Mind if we join you?
No, we've been waiting.
Hello, Wayne. Nice to see you, Wayne.
So, are we on for tonight?
Kath and I know this really neat restaurant down near the Peru.
Sounds great.
Oh, it's wonderful, Wayne.
What kind of food?
Italian.
Italian. Isn't that bad for your skin? All that oil?
Oh, Wayne. You used to love it when we used a lot of oil.
An awful lot of medical breakthroughs are happening now in dermatology, right, Warren?
Well, there's some really good work being done now, Shirley. I mean, we're making great progress in eczema, seborrhea, and psoriasis, Shirley.
Acne, the silent menace stalks the young.
Yeah. He's great, Kat.
Oh, yeah. The best.
Yeah, well, actually, you guys in the air see all the really interesting stuff.
Not really.
We gotta go. So how about our double date tonight?
Well,
Wayne can't.
Oh.
Well, some other time then?
Yes.
What do you mean I can't? If we went, it wouldn't be so bad.
Forget it.
Jack, there was an opening on the board this afternoon, so I slid Anthony Rizzo into it.
Without checking with me?
Well, I ran it by Dr. London this morning. Rizzo hadn't eaten all day, so he gave me the go-ahead.
Without checking with me?
I'm checking with you now.
Not a chance, Victor.
Why? Rizzo's ready to go in.
Well, I'm not ready.
You know, your ambivalence is really, really frustrating.
Yeah, so is your arrogance. You're getting to be a real surgeon.
Well, excuse me, but the man happens to have a tumor in his pancreas, okay? Look at his insulin levels. They're up, up, up.
Then how come the CT scan and all the other tests are negative? How do you explain that?
Okay, most insulinomas are too small to be seen in x-rays. The only way we're going to know for sure is to open them up and explore, so let's get on with it.
If we don't find anything?
We sew them back up and that's it.
I don't know.
Oh, great, you don't know. What don't you know?
Well, you want to do it, then do it.
So, you two guys finally got things worked out, huh?
Well, Anthony, we have reached some sort of an agreement, but to be honest, Dr. Morrison still questions whether surgery really is needed this time.
Yeah, I know. Surgeons versus internists, right?
So, we do have you scheduled for later this afternoon, but the final decision, of course, is yours.
You got reservations, huh?
I feel we could hold off a little longer for additional testing. I'd like to get a C-terminal insulin to find out if the insulin's coming from the tumor.
You a football fan?
Not really. Handball.
It doesn't matter. 1966, Michigan State versus Notre Dame. Playing for the #1 ranking. Parsegian?
Used to be the coach for Notre Dame.
Yeah, right. Ran out the clock playing for a tie. Bush, if you ask me. Play for a tie, you get a tie. I'm here to win. Let's go for it, no offense intended, Dr. Morrison.
None taken. I'll see you later on tonight, Mr. Rizzo. Victor.
Okay, let me explain the procedure to you.
Ah, don't waste your breath. Look, you're gonna go inside, you're gonna check things out. If you find something you don't like, you'll take it out. If you don't, you won't. Right? Right.
That about sums it up.
Yeah, I did 2 tours in 82nd Airborne helicopters. Want to talk about exploratory surgery? 68 Tet offensive. We go into the jungle, we didn't know what the hell we were gonna find. Sometimes nothing, sometimes a hell of a cancer. So don't you worry about me. I know the story. I know what's going on.
Somebody will be in to prep and pre-medicate you later on. I'll see you in a couple hours.
I'll be there.
Oh, I had a buddy in the 82nd Airborne.
No kidding.
Yeah, flunked out of Cal, got caught with a low number in the draft lottery. But I didn't think the 82nd was involved in the Tet Offensive.
Oh, yeah, we had a few boys there.
Okay. See you later.
The only way.
Hi. Got a cigarette?
I'm sorry, there's no smoking allowed in here.
Maybe you can loosen these up a little bit because they're so tight. I think that they're giving me bruises. Please, they're really tight.
I don't want you to be uncomfortable, but I'm not allowed to.
Oh, please.
All right.
Thank you. Oh, you're so kind. No, I'm gonna kill you,
Mark, I never would have pegged you for this kind of place.
Man cannot live on Bernays sauce alone.
What is this, flounder?
Icelandic scrod.
Good.
Actually, I did a bypass on the owner of this place. I drop by from time to time. The food's not bad, and the price is right.
You know, you really impressed the hell out of those kids today.
It's some world, isn't it? I mean, it's gotten to the point that if you say what you think, you're a hero.
Well, you speak your mind, it's true. Ever get you in trouble?
Are you kidding? All my life. It's caused me a hell of a lot of trouble. Now, you speak your mind, and you don't put people off. You know, I mean it. And you're not perfect either. But, I mean, people don't treat you like you got fleas. What is it in my personality that bugs people? That bugs you? Come on, give it to me straight. Don't pull any punches.
Mark, what do you...
Right between the eyes.
No, really,
Come on.
Well, you're a little short on tact.
Right.
You're rude.
Uh-huh.
Prejudice.
Uh-huh.
You're intolerant of people who don't behave in the way that you think they should.
Right.
Now, don't get me wrong. I like you well enough. I really do. But, well, you're really a closed, narrow-minded, judgmental human being, and I don't...
That's enough. Thank you, Donald.
Look, Mark, I'm sorry.
No. I respect you for that. For what you said. I'm gonna go to the job. I think this check is yours.
How does his pancreas look, Ehrlich?
Peachy keen. Soft without masses.
This fellow used to play hockey?
I don't think so.
He's got more scars than a maple-leaf goalie.
Okay, let's take another walk around the block through these adhesions. If we don't find anything, let's close them up. A little more O2, VJ. Looking a little murky here.
You're really enjoying yourself, aren't you, Ehrlich?
Biggest rush I've had since I hit the waves at Kaanapali.
Well, the way I understand it, surfers are born, but surgeons are made.
Hey, VJ, what's heaven in Hindi? Bahisht. Bahisht. Well, I think I found it in surgery. Oh, did you hear about him? He's got his intended coming over.
Yeah. Congratulations, VJ. First time?
No, I was intended once before. Her name was Devi Roper.
Did you marry Debbie?
No. When I came home from medical school, she was engaged to Gupta Giva.
Gupta Giva?
A useless son of a useless father. They own apartment houses in Patna.
Did you marry him?
No.
Why not?
Well, probably found out about his girlfriend from Malabar.
Wait a minute, what's going on around here?
We'll get an arrest.
VJ, give him 100 milligrams lidocaine, 2 amps bicarb, and calcium. Now, for God's sake, seal the air leak and open those lines. Ehrlich, open up the chest.
Scalpel.
Easy. Spread the ribs apart.
Okay, give me those retractors.
There's absolutely nothing.
Look at hotness house.
Come on.
Mary Abernathy?
Mm-hmm.
I'm Dr. Armstrong. I'm sorry I haven't gotten to you sooner, but I've been very busy.
Oh, I understand, dear.
It says you came into emergency complaining of stomach pains.
Yes.
And Dr. Fiskus admitted you because you were banging your head against the wall. He was concerned that you were going to hurt yourself.
Well, the pain was very bad.
I can understand that. It also says that you attacked a nurse.
Oh, I think attack is too strong a word, Doctor. I admit I did get a bit excited, but I had been waiting around for such a long time. And then they tied me down, and I was in a great deal of pain. Naturally, I panicked. Besides, I found the nurse to be very hostile to me.
How well do you feel now?
Oh, much better, thank you. And I'd like to go home.
I see. Well, I want to make sure that you're not going to hurt yourself again.
Don't worry, I won't. I lost my head, but it was just for a second.
Well, I'd like you to stay around a little longer so we can find out what the cause of your pain was.
Oh, no. Please, I'm fine, really. And I really want to go home.
Well, if you insist, I don't want to have to make you stay. But I will have to get an okay from Dr. Santeflaban. He's the senior resident on call tonight.
Oh, thank you, Doctor. You're so kind.
I don't know. You tripled on the table.
You couldn't wait to cut into him, could you?
It was routine. Nothing should have
It
gone
was
wrong.
surgery, Ehrlich. It was invasive. Something went wrong because ever since you did your first solo, you've been dying to cut again.
Guy's 80 years old. He's got hearing aids in both ears. I bring him down for x-ray, and I say, take off the clothes, put on the gown, and come across the hall for the x-rays. Well, he gets the part about loosening the clothes, but misses the part about the gown. He looks so funny and scared walking across that hallway. Bye. How did she get out? Give me security. Hey, what's wrong? Lucy, that's her.
Hi, Jack. You look tired.
Yeah, I'm beat. It's been a difficult day.
Yeah, I know. But cheer up. It's the desert flower. The flower that springs from the tiniest asphalt crevice that has the loveliest bloom. Know what I mean?
No.
Well, when things didn't work out with Wayne, I thought there'd be no happiness for me in this world. Then Warren and I found each other. Now I've found my happiness, and it looks as though Wayne has found his. And we're all going to be very, very good friends. Wayne, Warren, Shirley, and Kathy.
That's great.
I feel rather like that painting, Déjeuner sur l'herbe, Luncheon on the Grass, by Manet. Do you know the one? With the woman sitting naked and everyone eating.
You said you wanted to see me about something?
Right. The man who died in surgery, Anthony Rizzo. After he was opened, we found that his C-terminal insulin was negative. It didn't come from his own body. It came from a cow.
A cow?
That's right. The RIA is positive.
I don't get it. Cow insulin killed him?
No. It was an extremely high blood level of synthroid that reacted with the surgical anesthetic.
What would such a high level of synthroid be doing in his system? His thyroid function tests were normal.
I don't know. I suppose the same thing that the cow insulin was doing there. He must have taken a large dose of synthroid just before he pre-oped.
When did you examine the woman we sent up to psych, the one in restraints?
Mary Abernathy. I was called in for a consult.
Security said you released her.
That's right. I got an okay from Dr. Sinteflibon.
Why did you release her?
She didn't seem as though she was in any danger to herself.
Herself? The woman is crazy. She flipped out in ER.
She was absolutely coherent by the time I spoke with her.
Didn't you read my report?
Yes, but I'm telling you that by the time I saw her, she was in complete control of her faculties. I had no reason to hold her for 72 hours.
She threatened to kill me, for God's sakes.
Shirley, would you calm down?
Save it for your patients.
I've been thinking about what you said, Donald. I am difficult.
I didn't mean to hurt your feelings, Mark.
Oh, don't be silly. I'm man enough to take a little healthy criticism.
We all have our defects.
Well, you're damn right. I mean, you have to admit you're being all things to all people can wear pretty damn thin.
Well, I never thought of it that way, but at any rate, at my age, it's pretty hard to change.
My feelings exactly. What?
Come on in, Jack. What's up?
The weirdest thing happened. A patient of mine was operated on today and died on the table.
Who did the surgery?
Dr. Ehrlich. Dr. London was assisting. According to Path, the insulin in the man's body came from a cow.
This guy have a lot of scars?
Yeah, he's been operated on 7 times before.
Body temperature, bounce around, blood in the urine?
That's right.
Munchausen syndrome.
Sounds like it.
I don't understand.
Patients who fool their doctors into performing surgery that's completely unnecessary.
I mean, some of these sickos know more medicine than we do. They've got to trick the doctor into performing all the procedures.
My advice to you, Jack, is to call some of the other hospitals. Have them check their records. I'll give you even money that this fella's been in every hospital in Boston.
Why would anyone want to be operated on?
Like being patients. They get a weird kind of pleasure fooling doctors.
Some experts say it's just that they need some attention.
Unbelievable.
Isn't it?
Well, thank you. Both.
See you later.
So, Ehrlich lost his first patient today. Won't be the last.
Unfortunately. Some more?
Whoa.
Shirley. What's the matter?
They let her go.
Who?
That crazy woman from ER. She attacked me. She wants to kill me. And they let her go.
Shirley, she's a head case. They never follow up on their threats.
She said she was gonna get a gun and kill me. This is the worst day of my life. Between this psycho and you.
Me? What did I do?
Oh, come on, Fiscus. You and Kathy Martin were going gaga over each other in the cafeteria.
What?
Must have felt like old times.
That's ridiculous. I was only being nice to her because you asked me to.
Really?
Really. You're seeing things that aren't there.
I am.
Yeah. You know what we're gonna do? We're gonna go get your coat. I'm gonna drive you back to my place. I'm gonna make you a special dinner. And then we're gonna snuggle up on the couch with the blanket and watch TV and shut the whole world out. Okay?
Can I come in?
Yeah, sure.
I owe you an apology. The autopsy on Anthony Rizzo showed that he'd ingested a large quantity of Synthroid. When it reacted with the surgical anesthetic, it killed him.
What are you saying?
I talked to Westfall and Craig. They suggested I dig deeper into his records. So I called some other hospitals. Over the past 7 years, Anthony Rizzo has been admitted to no fewer than 15 hospitals.
What? What for?
Everything.
I don't get it. What's going on?
Well, I'm not sure, but I think he was suffering from Munchausen syndrome.
Munchausen. Shot down by the Baron von Munchausen.
So you see, it wasn't your fault.
I appreciate this. I've been lying here thinking. You're right, you know, about this compelling need I've developed to get back into the OR. You're always told that in order to be a good surgeon, you've got to be, aggressive, opinionated, eager to cut, but it's no good. I've got to try and curb that kind of thinking.
See you around.
Thanks.
Donald, we ought to see more of each other outside the hospital.
I'd like that.
How about dinner at my place, Sunday? Ellen makes a great pot roast.
Can I bring my kids?
Of course. And a date, if you like.
Sounds terrific.
Are you seeing anybody special these days?
No, no one in particular.
Good, great. Have you ever met my recently widowed sister-in-law, Carol?
No, I don't think I've had the pleasure.
Well, you will. Sunday night.
Mark.
Donald, I'd consider it a huge personal favor. Let's take the stairs. These damn things never work.
Which works for me.